Teledoc, a telebehavioral health solution, presented by Naima Grove, Jasmine Hicks, and Tamara Leslie. Mental health. The World Health Organization defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Like physical health, it is important to maintain good mental health. We get the most out of life when we do not have to deal with depression, anxiety, stress, addictions, and other psychological problems. Unfortunately, maintaining good mental health is not always a choice. While many mental disorders are known to be biological in origin, others are triggered by uncontrollable environmental factors. Mental disorders are among the leading cause of disability in the United States. In 2014, there was an estimated 53.4 million adults aged 18 or older with mental illness, including those with a serious mental illness. That number represents 22.3% of the adult population. The prevalence of mental health issues amongst our youth is also a major concern. In his blog on May 2015, Dr. Thomas Ensel, former director of the National Institute of Mental Health, stated that 20% of youth aged 13 to 18 live with a mental health condition. Mental issues affect millions of Americans. Consequently, it also costs businesses billions in lost productivity and disability insurance payments. The World Economic Forum estimates that mental disorders will cost the economy $6 trillion by 2030. Unfortunately, while millions experience these issues, access to effective care is often the biggest hurdle. The shortage of available mental health professionals is one of the two main barriers to access for mental health care. States with large rural and frontier areas have the highest percentage of people with mental illness at 19 to 22%. With the shortage of mental health professionals, those people are either forced to see providers who have no specialty training, travel long distances to see a mental health provider, or forego treatment altogether. Telehealth, which is already transforming the delivery of medical care, is opening new pathways to behavioral health care as well, namely through telebehavioral health. Current national statistics show us that there is a great need for telebehavioral health, and it will be a viable solution to creating better access to care. Teledoc is the nation's first and largest telehealth provider. They work with health plans, employers, organizations, and individuals to provide access to affordable, high-quality health care on demand. Teledoc continues to grow its portfolio of healthcare provider clients by allowing hospitals to provide greater access to care and treat the communities that they serve. The Texas-based company recently launched a behavioral telehealth platform that promises to provide delivery methods and services that will help more Americans address their mental health needs. Type of technology involved. Telebehavioral health primarily uses interactive audiovisual conferencing systems that run over high bandwidth networks. The central component of the interactive telebehavioral health is the codec, which provides compression, decompression, and synchronization of audio and video signals. Both the patient site and the clinician site need codecs. A typical setup includes a video camera, microphone, speakers or headset, and 1 to 2 display monitors at both the clinician and patient sites. In the past, telebehavioral health applications used point-to-point network connections. Now, due to the rapid diffusion of Internet and Ethernet networks, video conferencing systems that can work over Internet protocol networks have developed. The advantage of IP networks is that they can be shared by several applications, meaning that network costs can be shared as well. Teledoc's use of the most innovative technology landed it the number 27 spot on MIT Technology Review's annual list of 50 smartest companies in 2015. It was the only telehealth provider to make the list.
Analysis. How would it affect our solution? Now let's discuss some of the factors that will ultimately call for the implementation of teledoc. First, a quarter of the United States has some sort of behavior health condition. Health insurance policies do not always cover mental health conditions extensively, so it is not completely clear how substantial the mental health services Medicaid provides to its insured. 130 million behavioral health sessions each year could be addressed via telehealth channels. This will provide for a more convenient way to reach your physician in time of need, in addition to reaching them at any time during the day. Also, teledoc physicians would have to be licensed in multiple states, considering they will be dealing with a nationwide database of clientele. Courses of action. How would it be delivered? The course of action would proceed by way of a very simple delivery system. Because this HIT solution is pretty straightforward, the specialist can be reached on multiple platforms. Patients can reach their caregivers by phone, web, or mobile app 24 hours a day, 365 days a year. This gives a flexibility to the healthcare system that previously wasn't available to behavioral professionals. In addition to this, telebehavioral specialists will no longer have a time limit on the sessions they have with their clients. This is specific to teledoc. They can speak with their doctors as long as they please, and every session is documented so they can keep track of their progress. They also maintain their own electronic health record of their members, so privacy is a number one priority. Implementation and acquisition. This system can be implemented within a month and customized to meet the organization's needs. Since we will only be looking to capitalize on behavioral health, we could potentially have it up sooner than 1 month. Secure and remote care monitored 24/7, 365 days makes it even more appealing on the security and privacy aspect, with Teledoc providing a full service operations center. There is also the potential for Teledoc to provide a return on investment of about 400%, saving from the typical doctor's visits and ER visits that normally patients see. Delivering telebehavioral solutions. If we deliver on the telebehavioral solutions as proposed, this would help account for the healthcare provider shortages in rural and low-income areas. It will also help lower costs for those who cannot pay for psychiatrists. Only 55% of psychiatrists and 60% of non-MD mental health professionals accept insurance. Teledoc will help solve the issues outlined here.
The general satisfaction of telebehavioral health or e-mental health services of patients are rated moderate to high. There are many factors to choosing e-mental health as opposed to traditional methods. Some of these include anonymity, privacy and confidentiality, the accessibility and convenience of it, and the level of control over the treatment. Most participants appreciate the privacy, confidentiality, and anonymity of accessing the program from a computer at home or in another private location. One study quoted, "You might learn more in a live group, but communication via a chat box is much easier and you dare to say more." Some patients feel more comfortable being able to say whatever is needed behind a computer screen than face-to-face interaction. Accessibility and convenience of online services are easier in that anyone can access them from home or on the road. This allows users to access wherever they want and whenever. The ability to access these services were rated really high. Patients are able to choose the medium in which they want to be contacted, either via online or by phone. They have many options online, such as discussion boards or chat rooms to engage as they would like to. Participants in studies found they were able to open and share emotions and experiences more so online than in person, which allowed for relationships to be developed. In conclusion, with technological advances, telebehavioral health, or e-mental health, is here to stay. With mental health disorders in the United States being the leading cause to disability and the prevalence of mental health issues among the youth, being able to provide care is essential. E-mental health is able to accommodate the shortage of mental health professionals by providing more access and easier access for people. The technology involved with any online service can be as simple as your cell phone or home computer to include utilizing video cameras, microphones, and speakers or headsets to communicate with healthcare providers. E-mental health services are able to provide round-the-clock services 24 hours a day, 7 days a week for 365 days a year. That literally means that anyone can access care at any point in the day from anywhere. Services can be rendered anywhere, whether that is home, at work, or on the road, and it can be customizable to meet anyone's needs. This allows for a wide range of services available to anyone and makes it much more affordable, as only 55% of psychiatrists and 60% of non-MD mental health professionals accept insurance. The general satisfaction of e-mental health services of patients are rated moderate to high. There are many reasons why someone would choose e-mental health or telebehavioral health services versus traditional methods, which include anonymity, privacy, confidentiality, accessibility, and convenience. As technology advances, many options become available to provide quality and affordable care to everyone. This allows for more doors and options to open for healthcare overall. Telebehavioral health or e-mental health is just one of these options and solutions to everyday care for everyone.